Has faced criticism for the quality of health care available here, but that's really changing. And doctors at UMC have made some huge strides in recent years with organ transplants.
Yeah, Nevadans are also helping by choosing to become organ donors. And News 3's Steve Wolford is with us now with an update on who's offering the gift of life and who's receiving it.
Well, at the present time, UMC is the only hospital in Nevada with a transplant program. It's limited to kidneys and an occasional pancreas transplant, but it's not as dire as it might seem for a couple of reasons. UMC's program is expanding, and Nevadans are proving to be very generous organ donors.
I had an opportunity to register at the DMV when I was 16 years old just because I thought it was the right thing to do.
Heather Osipovich says she decided to become an organ donor after her mother needed a bone transplant and saw how it changed her mom's life.
And I just know that it gives hope to those waiting on the national wait list, whether it be for an organ donation, an organ transplant, or even those tissue and ocular transplants.
Heather is one of countless Nevadans who've made the decision to be an organ donor. In fact, Gordon Prouty with the Nevada Donor Network says the Silver State sets the gold standard.
And on a per capita basis, we donate more organs than any other state in the union right here in Nevada.
More than enough for the 700 Nevadans currently on the wait list, which has over 100,000 people nationwide.
The sad part of that is more than 90% of the organs leave the state because we don't have the transplant services we need.
But Dr. Sunil Patel says demand has reached the point that UMC is taking steps to add a liver transplant program to the existing kidney and pancreas staffing.
Oftentimes it's a balance between the volume of patients who need a transplant versus the resources that have to be divided between different services.
In other words, only 5 Nevadans are currently waiting for a lung transplant, but it would take 10 doctors and staff to care for them. That's why UMC is using its available resources now to make its kidney transplant program one of the best in the nation.
And it's actually, being in Nevada at this point is beneficial for patients on the wait list. We have people coming in from California and other states to get transplanted here. And that's partly because the program's evolved to be very efficient.
Well, Dr. Patel says patients who do make the UMC list are more likely to receive a kidney transplant faster than almost anywhere else in the nation. And since COVID, get this, UMC has grown from 48 kidney transplants a year to 188.
Wow.
Someday we might see heart and lung transplants available in Nevada, but again, because of the higher care level required, Dr. Patel says for now, those volumes just aren't there yet. I'm Steve Wolford, News 3. Back to you.